My name is Kelly Smith. I manage the wellness program, and I want to thank you for coming to our first annual Men's Health Awareness Luncheon. Thank you for all of our guests for being here. Right this second, I'm going to bring our 58th Mayor, Justin Bibb, up to do opening remarks.
Good afternoon. How y'all doing today? Well, on behalf of the entire city of Cleveland, I want to thank Kelly for organizing this important event to celebrate Men's Health Month. I know that sometimes I hate eating healthy, and I hate going to the doctor, and I hate exercising. But all those things are so important to our health, and our communities need us, our families need us. Hopefully that's some vegan barbecue in the back. But let's enjoy this month. Let's spread the word about the importance of taking care of our well-being so we can continue to serve the city, and just know that I'm grateful that you all took time out of your day to join us for this important event. So thanks so much, and have an amazing and safe 4th of July holiday, okay? Appreciate it. Thanks.
Good afternoon, everyone. I'm Patty Mastriani with the Wellness Program. And I just wanted to do a brief presentation of our first doctor. He is from Metro Health Hospital. His name is Dr. Charles Bodlin. He will be doing a brief presentation on the importance of men's health. Dr. Bodlin joins the professional staff of Metro Health in the role of Medical Director of Inclusion, Diversity, and Equity, where he will provide thought leadership, perspective, and vision on the multidimensional matters of diversity through the lens of a clinician. The role will be key to the development of programs to promote and strengthen an inclusive and diverse culture. He will also practice clinical urology at Metro Health. So please have a warm welcome for Dr. Charles Bodlin.
Yeah, good afternoon, everybody. Can you all hear me? So yeah, my name is Dr. Charles Modlin. I'm a practicing clinical urologist. And for those individuals who do not know what a urologist is, we're the most important specialists that there are in medicine, from our perspective. So we're medical and surgical subspecialists who have expertise in treating the disorders of the urinary tract, which includes the kidneys, the ureters, the bladder, and also we specialize in the treatment of men's health and the male reproductive system. So I'm over at Metro Health, and as was indicated, I'm also the medical director for the Office of Inclusion, Equity, and Diversity. I've dedicated a lot of my career towards addressing elimination of health disparities, particularly in African American populations, and even more so in men of color, because men of color have the highest incidence of healthcare disparities of any group in the United States. Healthcare disparities refers to a situation where a certain segment of the population has a higher incidence of certain disease states, diabetes, hypertension, heart disease, a variety of cancers, including prostate cancer. One of the disease states that I treat and diagnose is prostate cancer. And prostate cancer actually develops twice as often in men of color, black men, and twice as many black men die from prostate cancer as well. So I just wanted to highlight and stress the importance for all men, not just men of color, to undergo preventative health screenings. Prostate cancer actually is the second most common cause of cancer deaths in men, lung cancer being the number one cause. And some of the predisposing factors that contribute to the incidence of prostate cancer in men is smoking, but there is actually a hereditary component as well. So it's important for men and families to talk to each other and relate what are some of the most common health matters and health concerns that occur in your family. You need to talk to your boys, your adolescent boys, your young men, to let them know what type of conditions are prevalent that you may personally have and that your relatives have had, because those conditions, they will be more susceptible to those conditions as well. In the case of prostate cancer, the national recommendations are you should start screening for prostate cancer if you're an African American male at age 40 years old. If you're a Caucasian American male, you don't actually have to start screening until you're 55 years old, unless you have a strong family history of prostate cancer in your family. That's a 15-year differential based on race, whatever the definition of race is. Race, I believe, can be used as a surrogate marker for the likelihood that given individuals or group of individuals may have a certain higher incidence of disease states. Now, a lot of men, regardless of race or ethnicity, they're fearful when they hear about that scary prostate exam. There's a lot of myths and misconceptions as to what a prostate exam is, what it entails. I saw Chief Magistrate Gregory Clifford here. I saw him here earlier. Oh, there he is. So, Judge Clifford has actually volunteered to come up and let me demonstrate a prostate exam on him. To show how painless it actually can be. But in fact, actually nowadays, in most situations, we don't even have to do a prostate exam at all. There's a simple blood test called a PSA. Stands for prostate specific antigen. And again, black men start getting that at age 40, white men 55, unless you have a strong family history, you get it done earlier. But through that simple blood test, it doesn't diagnose prostate cancer. It actually tells us, the primary care physicians, the urologists, we're the ones who are ordering the test, the cancer doctors. It tells us the likelihood that you may have prostate cancer, and it guides us into determining whether or not we need to perform a prostate biopsy, which is how we diagnose prostate cancer. It literally takes about 5 minutes to perform a prostate biopsy. We get the results usually within a week. Also, the good news now is that unlike when I was training decades ago, now actually most men, there's different grades of prostate cancer, there's different degrees of severity. Most men who are diagnosed with low-stage prostate cancer with PSAs under 10 do not need to necessarily have treatment. The definitive treatment, the therapy or the treatment is either surgery, that's complete removal of the prostate, or radiation therapy. But now there's something that we call watchful waiting or active surveillance. So just because you've been diagnosed perhaps with prostate cancer doesn't mean necessarily that you're going to need to necessarily get treatment. So prostate cancer is one thing that we need to be aware of in terms of preventative health screenings. Everybody should know what their blood pressure is and get your blood pressure checked several times a year. Just like prostate cancer, you can have high blood pressure and not have any signs or symptoms whatsoever. So, and I forgot to mention that, you don't have to have, most men diagnosed with prostate cancer have no signs or symptoms. But in blood pressure, high blood pressure, we call it, hypertension also. It's called the silent killer. Untreated, undiagnosed, unrecognized high blood pressure can lead to heart attacks, strokes, peripheral vascular disease, kidney failure, and something that men don't want to talk about. I'll mention it even though we're in mixed company, erectile dysfunction. As a urologist, that's one of the specialty areas that I address, men with erectile dysfunction, but it usually results from untreated, uncontrolled, long-standing high blood pressure and or diabetes. So you got to get checked for your blood pressure. A normal blood pressure is 120/80 or less. Know what your numbers are. Every man needs a primary care doctor in addition to a urologist. Again, know your family history. Get screened for diabetes also. There's a blood test called a hemoglobin A1C. There's also a fasting blood sugar. Again, your primary care doctor will order all these examinations. Know what your lipid profile is. That's your triglycerides and your cholesterol. You should have a handle on that. Also, there's another test that that is very important. It's often not done. Vitamin D level. Very easy to get your vitamin D level checked. Low vitamin D levels are associated with a higher incidence of heart disease and various types of cancers. And low vitamin D levels are prevalent, especially in people of color who have greater degrees of pigmentation in their skin. Get checked for kidney disease. It's very easy to get checked and screened for kidney disease. You go to your doctor. We draw a simple blood test. It's called a serum creatinine. And it also is preferable also to give a urine sample. We will dip the urine sample. We're checking for any microscopic blood or protein in your urine. Normally, you shouldn't have any blood or protein in your urine. So get screened for prostate cancer, kidney disease, your lipids, your vitamin D. Also, colorectal cancer. You can have colorectal cancer and not necessarily have any signs or symptoms at all. The best screening test to screen for colorectal cancer is a colonoscopy. A lot of men are afraid to get that. Colon cancer is prevalent in my family. I've had 3 colonoscopies, and I'm only 40 years old, you know. I wish, but I've had 3 colon. It's very simple. You just drink the stuff, it cleans you out. You go in, they put you to sleep, you're done before you. It's so simple. And you can avoid a lot of problems by having these screenings. We're here for you at Metro Health. One thing I would like to mention also is, and I have some magnets announcing that our next Minority Men's Health Fair is going to be Thursday, April the 27th, 2023. We just kicked off our first health fair at Metro, April the 28th. We had over 1,000 men attend. Again, it's called the Minority Men's Health Fair. It's actually open to everybody, even women. But again, we're trying to reach out, especially to men of color, because they have the highest incidence of these disease states and lowest the life expectancy out of any group in the United States. So with that in mind, I would say also, I don't have to say too much about it because we have an expert coming up to speak after me, Dr. Marwahal. Historically, a lot of times, patients, the community, men especially, physicians, we've ignored the importance of mental health. And now I think it seems like since the George Floyd incident, I think nationwide we've come to grips to understand that, recognizing that perhaps we might need to address our mental health concerns, stress, anxiety, depression. It's not a sign of weakness. I think we need to start teaching our young men. When I was growing up, I was told if you fall down, you better not cry. You better, you just get up, wipe yourself off, and just go about your business. But that line of thinking has actually been perpetuated as we men grow older, to where, those of us in the older generation, a lot of times we've been taught that it's a sign of weakness if we admit that we need mental health. But I'm not going to talk too much about that because we have an expert coming up here. So with that in mind, I'd just like to thank you for having me speak today. And it looks like I'm going to be hanging out. I'm going to be loitering here in City Hall if you're serving food like that every day. So you'll see me back here often. So thank you.
As a token of our appreciation with the Wellness Works and Department of Human Resources, just wanted to present Dr. Charles Maudlin with a small gift. Thank you. Okay, so our next speaker that will be presenting is Dr. Raman Marwaha, and he is the Vice Chair of Education and Faculty Development, Psychiatry Residency Program Director, Child and Adolescent Psychiatrist at Metro Health System. So he will come up and he just has a brief PowerPoint presentation for you. Thank you.
Good afternoon, everyone. Hopefully you can hear me. So thank you for inviting me to be part of this wonderful occasion, celebrating Men's Health Month. And as was introduced, I'm a psychiatrist. I'm an adult psychiatrist and a child and adolescent psychiatrist as well. And I'll be kind of briefly talking about men's mental health. My goal today is just going to be talking about kind of awareness about kind of that, again, a lot of men do have mental health problems, and talking about awareness, what we can do about it as well. And again, after the talk, if anybody wants to kind of talk about anything, I mean, feel free to kind of ask anything. I'll be here for a little bit as well. Or if anybody else has any other information they wanted, I'll be happy to share our contact information as well. Okay. So, again, why are we talking about mental health? So as you can see, in our country, in the United States, there are 151 million men. And we know that 1 in 5 adults have a mental health problem. So almost 20% of adults at one time or the other of their life, they've gone through or they've suffered to some kind of mental health concern. So that's a staggering figure, actually, 20%. So that means 1 out of 5 people in this room at some time have actually gone through a mental health concern. Now, talking about different mental health disorders, of course, there are different types of mental health disorders. It's not as if there's only one mental health disorder. One of the most common ones that we all know about is depression. So depression, there are actually 6 million men who have concerns with depression in our country. So that's a big, big figure, and that's why we're kind of talking about this today, because this is very common, very prevalent. In men especially, there's lots of evidence that it goes undiagnosed. And what are the reasons for that? Again, out of a lot of reasons, one reason is actually kind of the symptoms of depression in men. So we all think that depression is when somebody's feeling sad, somebody's kind of crying. That is one of the most important or most common symptoms of depression. Interestingly, in men, there are actually atypical symptoms that actually men go through. And the most common one is actually kind of a lack of interest or lack of motivation, not wanting to do things that you want to do, that you enjoy. Instead of sadness, there can be irritability. And same for actually young men, young adolescents, boys actually. The most common symptom of depression that we see is actually irritability rather than sadness. So depression comes in all kinds of forms. Sadness is one type of it, but there are other symptoms of depression as well. And in boys, in men, sometimes it goes undiagnosed because of the way it is presented. Thank you. So some other mental illnesses and how common they are. So anxiety disorders. Again, there are 3 million people in the country who go through anxiety disorders. Again, extremely, extremely common. Bipolar disorder. Bipolar is a different type of mental health disorder. Depression and anxiety are kind of more common, so a lot of people know about it, basically. Bipolar is a type of mental health disorder in which you have these mood swings, where you can have episodes where you feel too happy, you don't sleep, you do too many activities. Interestingly, a lot of people who sometimes are bipolar can be very creative. They can sometimes do a lot of things in a shorter period of time, but then they kind of cycle that with depressive episodes, and that kind of interferes with their functioning as well. So there are, again, around 1 million people in the country with bipolar illness. Psychosis or schizophrenia. That's another type of mental health disorder in which people may hear voices in their head that are not there. They may feel somebody's out to get them, what we call as kind of paranoid ideations. They may think somebody's sending them messages. So again, 3 million people in the country have a diagnosis of schizophrenia or psychosis. And interestingly, 90% of them are actually in men, and it's diagnosed at a young age, when they're adolescents or when they are young, before age 30. So a lot of our young men basically get diagnosed with schizophrenia psychosis. So it starts early in life, which is really important to know. Another big mental health disorder is substance use. So substance use has again rapidly grown over the past few years, and 20% of men develop alcohol dependency at some time or the other. And alcohol is one of the substances, apart from other substances that can be used. For example, marijuana, they can be opioids, they can be benzodiazepines, they can be all kinds of other substances that can be used as well. And alcohol is one of the most common ones as well. Okay. Now, another big topic in mental health to be aware of, and a lot of people don't like talking about it, but suicide. So this is, again, a very, very big and relevant mental health concern in our country. Its highest rate is, traditionally, its highest rate used to be in Caucasian elderly men. So that's where we used to see the highest rate of completed suicides. It's the 7th leading cause of death among males. So that's again, so 7th leading cause of death. And again, it accounts for 2.2% of male deaths. A very important fact, and I'm giving a lot of statistics, but men die 4 times more often than women by suicide. A lot of women do suffer from more depression or anxiety, while men end up dying more from suicide. So completed suicide is more common in men and really 4 times higher. So men are at higher risk of suicide as well. And some of the factors, basically risk factors, are again social isolation. And this is something which has really come up during the pandemic. In the pandemic, a lot of people have been socially isolated. Traditionally, a lot of men who were going to do their to their office to do their work, basically now we're staying at home, which led to kind of social isolation or other problems as well. Again, a lot of unemployment, again, in the economy, again, if there's loss of jobs, a loss of finance, that also kind of is a big risk factor as well. Substance use, again, if somebody's using substance, that puts their risk of suicide really high. History of trauma, history of abuse. And trauma can be the traditional trauma that somebody goes through: physical abuse, any kind of sexual abuse, any kind of emotional abuse. A lot of trauma nowadays can be because of what people are seeing on the TV, what they're hearing, what they're reading about as well. Everything is about social media nowadays. I see so many young men in my clinic who come up with, I just saw one last week who is depressed because of all the different trauma that basically is going on in the community, and seeing all that basically kind of play in social media as well. Now, younger men actually are becoming at higher and higher risk. And interestingly, the latest statistics are that, again, there is healthcare disparities in mental health, and men of color are more at risk actually of suicide as well. Yeah. Okay. Now, sometimes it's very difficult to understand why do these things happen. And the difficulty with this is because, for example, as we're talking about kind of medical illnesses, we have all these kind of lab tests. We can do a lab investigation, we can do an imaging scan, we can do an X-ray. If somebody has chest pain, you do all these kind of tests and you're like, okay, you're having a heart attack, you have a congestive heart failure. With mental illness, the tricky part becomes that we don't have kind of lab tests to kind of identify and to say, okay, you're depressed, okay, this is the biomarker, this is the level, this is what this level says, so this means you are depressed or not, basically. So it is kind of a lot of the time dependent on how everybody is coping, what they're going through as well. And there are different kind of factors attributed to mental illness. So one is genetics. Genes do play a role. So we know mental illnesses, they run in families, whether it's depression, whether it's anxiety, it's bipolar, psychosis, suicide as well, any kind of mental illness, substance use, all of them basically, they run in families. Then there is a biological component, basically. So we know that, for example, in depression, there's a neurotransmitter called serotonin, which is low. And that's what has been repeatedly found in adults, in men who are depressed. Same for other disorders. In a psychotic disorder, in psychosis, what we say, if somebody's hearing voices, we know there's a neurotransmitter called dopamine, which is high. So there is a biological component, and this is important to know because this is how medications help with mental health disorders. Then another component, and again, mental health disorders are kind of multidimensional. Like there is the genetic component, there's a biological component, there's actually a psychological component. So it's the way you deal with stress. Everybody has a different coping mechanism. So everybody has different psychological safety-mindedness or psychological coping mechanisms. So it's how you kind of deal with it as well. And then another important factor is social factors. So the environment that you're kind of growing up with, what kind of supports you have basically, what kind of trauma you've been through. If kids are going to school, what are they seeing there? In what kind of neighborhood they are, what kind of socioeconomic strata they belong to as well. So all those factors also kind of weigh in as well and contribute to mental illness. Okay. So the important thing to know is, again, we've talked about how prevalent mental illnesses are. Again, in all adults, in kids, and in men, very, very common. We've talked about, why does this happen? The good news is that there is treatment. But the problem is that sometimes they're available, but men are less likely to seek help for depression, for substance use, and there could be a variety of factors why they don't seek help. We kind of talked about that sometimes their symptoms could be atypical, but it could be social norms, as Dr. Maudlin was talking about. A lot of times boys are brought up that, if you feel pain, if something happens, don't cry, don't show it, don't talk about it, basically. So the reluctance to talk about it, the reluctance to follow kind of social norms, or there's a stigma associated to it. If you have a heart illness, you can talk about it. If you have depression, you don't want to talk about it. So all those things kind of play a role in kind of getting help as well. And lack of awareness. A lot of people are not aware that this exists, basically. That yes, depression is common. I mean, anxiety is common. 1 in 5 adults will go through this at some time or the other, and it's important to provide them with the appropriate support. We also know that research shows that men of color are less likely to seek mental health services and, important, receive treatment actually, when compared to white men. So both ways actually, they're less open to kind of seeking care. But even when they go and see sometimes a healthcare provider, sometimes it's kind of like pushed aside. So they also get less treatment as well. And there are consequences to kind of untreated or undiagnosed mental health illness. And again, broadly, I mean, there are financial consequences. So actually, statistics in our country show that 30% of DALY is basically kind of how many days of your active life basically are you kind of losing out if you're ill. So the highest one is attributed to actually what we call as neuropsychiatric disorders. So mental illness is among them. So the highest one, 30%. So anybody out here, like if for some reason you kind of lose your productivity, 30% of that is because of mental illness. Then, of course, there are social consequences. We know it leads to a lot of problems. If somebody has depression, if a man has any mental illness, it leads to problems, familial problems. It could lead to higher divorce rates, problems with kids, problems at work, loss of job, unemployment. And then physical. We know that in our brain, in our body, everything is connected. Our brain is actually kind of is the epicenter of what goes on and how we think and what we're doing. So if you're not mentally well, it's going to cause physical symptoms and it's going to impact how you're doing as well physically. So again, for mental health disorders, it's important to be aware that it's common. It's okay if somebody has a mental health disorder and you can seek help. And there are a variety of forms of actually treatments, basically. They can be counseling. Once an assessment is done, depending on kind of what you need, there are all kinds of mental health counselors, be it social workers, be it psychologists, psychiatrists, and once an assessment is done, they can kind of decide what you need. And a lot of times it's just counseling, basically talking to a counselor, gaining the coping skills, working on the social support system, so the psychological and social factors. But sometimes medications are also needed to help with the biological part, to help with the neurotransmitters. And of course, I mean, I want to just make sure, because we're talking about mental health disorders and suicide, that, it's important to know that we have even crisis lines. So we have, for our county, in Cuyahoga County, we have a mobile crisis line or front line, which is 24/7 available if anybody calls. Of course, we actually now, in the next few days, there'll be a national suicide prevention line, 988, which will be rolled out similar to 911. And again, it's just for any mental health crisis across the nation. So this is a big move. So you can always, in the next few days, 988 would be available to be called. And of course, there's 911, and there is all kinds of emergency departments. We at Metro Health, of course, are the county healthcare system, and we're there for all the county, all our county kind of population. And I just wanted to give out our numbers as well for our adult and our child clinics as well, because we have, again, wonderful staff. We have all kinds of services. We have outpatient assessments, we have inpatient, we have intensive outpatient, we have services for substance use, for kids, for adults, and for all kind of mental health disorders that we kind of talked about. So thank you for kind of listening to me, and hopefully this creates some awareness about mental health, and if anybody is in need for any kind of help, you can always kind of reach out as well. So thank you, and have a nice 4th of July.
That concludes our event for today. We want to say thank you for coming out. Thank you to the doctors from Metro Health for coming out and speaking to our audience. We also would like to say welcome back, because we haven't seen a lot of you because of the pandemic, and we're glad everybody's back. So thank you for coming, and look for your emails for upcoming events for wellness. Have a great afternoon.